There are some fears that people expect you to have when you're seriously ill, but the one that keeps me awake at night, it's not the disease. It is something that nobody warned me about. So sit back, because we're about to talk about one of those uncomfortable truths that most people are thinking, but very few are willing to say out loud because it's just too scary. I've been a daughter, a mother, a grandmother, a wife, even a professional eye roller, and occasionally, probably the reason somebody might have needed some therapy. One minute life is loud and messy and overwhelming, and the next thing you know, you're staring at old photographs, wondering where the years went, or looking in a mirror wondering who that old woman is. But around here, we tell the truth about life. Let's get into this mess. Good morning, y'all. Yesterday morning, not long after I finished my jammy talk that I do on my patio, which is where I'm at right now, you might not be familiar with it. Anyway, I ended up calling an ambulance. I was having chest pain, and when you have heart failure and pulmonary hypertension, that's not something you just brush off and hope it goes away. Thankfully, everything turned out okay, at least this time. But it wasn't because of anything anybody did at the hospital, that's for sure. And as I sat there thinking about everything that had happened, I realized something. The thing that scares me the most, it isn't actually my heart disease anymore or any of the other myriad of health problems I have. I didn't even wondering what diagnoses might come next. The thing that terrifies me is wondering if, when something really does go wrong, if anyone is actually going to listen and take care of me. That's a horrible feeling, because hospitals are supposed to be the place you run to when you're scared, not the place that you dread calling or dread going to because you're afraid you're going to leave even more helpless than when you walked in. And before anybody misunderstands what I'm saying, let me be very clear. I have had some absolutely wonderful doctors and nurses over the years. People who were compassionate, thorough, who probably don't even realize how much they meant to me after a long line of people that worked so much. And this video is not about them. It's about what happens when you don't get one of those good people. And that seems to occur a lot more often nowadays. It's about what happens after you've had quite a few experiences where you feel dismissed, rushed, or like nobody really cared enough to hear what you're trying to tell them. Because after it happens once, you shake it off. After it happens twice, you start wondering if maybe it's just bad luck, you know. But once it happens 3 or 4 times, and about 90% of the time that you're there, something changes inside of you. You stop trusting the very people that you're supposed to be able to trust the most. And that is a dangerous place for any patient to find themselves, let alone one with serious illnesses. And let's talk about why. Now, you know I've lived with enough medical problems that hospitals have almost become a second home. There's diastolic congestive heart failure, pulmonary hypertension, autonomic dysfunction, rheumatoid arthritis, chronic pain, more specialists than I can count, all the autoimmune disorders I have, Sjogren's, etc. And you'd think after all that, hospitals would be the one place that I could feel safe. Instead, they are the place that I am terrified to go. And that should never happen to anyone. Not at all. But they've earned that. They've earned that. People ask me all the time if I'm scared because of my heart. Of course I am. But honestly, the thing that keeps me awake isn't always my diagnosis. It's wondering that if something really goes wrong tonight, who's actually going to listen? Because once you've been brushed aside a few times, that fear, it starts following you home. Sometimes it starts at home when you tell somebody you need an ambulance that you've told over and over, and they're just like, you're fine. Why don't you just rest? I've also had times where I've gone to the emergency room because I truly believed something serious was happening. Chest pain, difficulty breathing, pain in my jaw, symptoms that someone with my medical history should not ignore. And instead of feeling reassured, you feel like you're inconveniencing somebody. You start noticing the eye rolls, the rushed conversations, the assumptions before they've even finished hearing your story. Sometimes you leave with more questions than answers, with your pain not addressed, with the right test not being run. Sometimes you're still hurting. Sometimes you leave wondering whether you should have gone at all. And that is a dangerous place for patients to be emotionally. Not just emotionally, but that's what we're talking about today. People think the emergency room visit ends when you're discharged. No, it doesn't. The next time symptoms start, you hesitate. You ask yourself, am I overreacting? They probably won't do anything anyway. I don't want to be treated like that again. And then you wait longer than you should. Not because you're stubborn, because you've lost confidence that asking for help will actually help. That is a terrible position to put patients in. Shame on you people. This is so much bigger than just me. I know this is not just my story. I see it every time I sit in a waiting room. Older people, disabled people, parents with sick children, people who already feel scared. Some are treated with incredible compassion, and others feel like they're just another chart to get through before the end of the shift, and I see it happening. I understand healthcare workers are under enormous pressure. I do understand that. And there are doctors and nurses who have been absolutely wonderful to me over the years. This isn't about blaming everyone, but it is about recognizing that when compassion disappears, even occasionally, the consequences can be enormous. And that seems to be more the norm nowadays. One patient who loses trust may delay seeking care the next time they have symptoms that truly are life-threatening. The way you act could literally kill somebody. Think about that. Sometimes doctors think that patients expect miracles, but most of us do not. We know medicine can't fix everything. Sometimes there's not a cure. Sometimes there isn't even a treatment. But we still need someone to hear us, to examine us carefully, to be thorough, to explain what they're thinking, not to lie to us or assume we don't know, to tell us why they believe we're okay or why they don't, to treat us like a human being instead of the next name on a computer screen. Feeling heard, it doesn't cure the disease, obviously, but it can restore something that's just as important. Trust is enormously important in this situation. Now, if you work in healthcare, thank you. Truly. Many of you have carried me through some of the hardest days of my life. But if you have become so burned out that every patient looks like an interruption, or if you think you can just say whatever and people will believe you, whether it's the truth or not. Please remember, to that patient, you may be the difference between whether they seek help the next time or stay home because they don't believe anyone will care. So sometimes that decision can mean life or death, even if it isn't right during that moment. So if you have ever walked away from a doctor's office or an emergency room feeling unheard, or had to sign out against medical advice because your needs were not being addressed, know that you are not alone. And if you have been blessed with a doctor or nurse who made you feel safe, you hold on to them, because they are worth their weight in gold. I know, I have one right now, my primary care physician. Because in the end, being heard can be just as healing as being treated. Thank y'all for spending a little time with me today. Until next time, you remember, your life doesn't have to look perfect to be meaningful. But you need to be real careful about the people that are around you. And make sure that you're being treated the way you deserve, that your needs are being addressed, from your significant other at home all the way to the emergency room doctor and nurses that you're in front of. All those things are important. I love you guys. We'll talk more another time.
Quiet and speaking her mind. Now she stands where she belongs, right in her truth where she's been all along. She's rolling with Tammy, loud and free, saying what you think but don't wanna be. No filter, no fuss, no let me be nice. She said what she said and she said it twice. She ain't here to play, she ain't